In Chapter 8 of Yoga Therapy at the Wall, we start to look at some of the different things that we can do with the spine. And in the chapter, I organized it from the top to the bottom. So sometimes we forget that the neck is a part of the spine, and especially in what we do in the modern world with driving and typing and looking down at our phones, pretty much everybody's neck needs a little bit of extra attention. So one of the things that I like to do is use a block behind the upper back, kind of behind the shoulder blades and the thoracic spine, to keep the upper back still and space you away from the wall so that you have all the room around your head to do lots of important neck movements. You can take the block and put it that way or that way, depending on how much space you feel like you need. And then it's important to position yourself so that you feel like you have pressure back into the block. You're straight. The block isn't pushing you too far forward. If your hips are too far back, you're going to feel like the block is throwing off your alignment. So I'm pretty happy with that position in the block. And then I'm going to start to squeeze my shoulder blades back slightly into the block, making space across the chest. And then I'm going to hold that back there and turn the head. Really seeing how far I can go without the opposite shoulder trying to follow. Okay, and then I can do the same thing with lateral flexion. Ear to shoulder, drop the opposite shoulder down, maybe even push the fingertips down into the mat, but keep that squeeze back. Okay, so the place where this becomes really helpful and effective is actually when we start to look up. The block has created some space between the back of my head and the wall. So now I'm going to create that squeeze back with my shoulders, line up my head, inhale, look up toward the ceiling. Feel that opening down the throat. Exhale, come back down. When we have the block here, we're also helping to just isolate the cervical spine, the neck, where the thoracic spine is being held in place. So we don't get this confusion of where the movement is coming from. It's very isolated. One of the movements that I find to be the most helpful after I've been on the computer for a while is looking up, but specifically looking up to the right. So I feel this line of opening from the bottom of the jaw, right underneath the ear, to the top of the shoulder. Come back into the center, and then the same thing up and to the left, push down with the opposite fingertips to find that line of opening kind of to the side, but still the front of the neck. And then back to center. So you can explore those different ranges of movement, keeping the thoracic spine isolated or still, and just isolating the cervical spine. Seeing how much freedom of movement you have there.